Let's talk about diabetes glucose control. So there's lots of different information out there about what your blood sugar should be. So a typical patient with diabetes, not somebody with severe comorbidities, not someone who's extremely elderly, but typically with type 2 diabetes, I like to see fasting blood sugars between 80 and 120. This is a good range, and ideally 80 to 100. Prior to meals throughout the day, you definitely want your blood sugar less than 140 and ideally around 120 or less. After you eat, your blood sugar is going to go up. So 1 hour after a meal, I say less than 180, and 2 hours after a meal, less than 140. Again, prior to your next meal, ideally you're down to 120 or less. Bedtime is very similar. Some people say I like to go to bed with higher blood sugars because if not, I get low overnight. If that's the case, some of your medications may need to be adjusted. You should not get low overnight in a fasted state with diabetes if you're on the correct amount of medications. So prior to bed, it's very similar. I like your blood sugars around 120 prior